Hello and welcome to Emergency Medical Responder, your first response in emergency care. This is Chapter 6, the human body. This is going to cover basically all the anatomy and physiology you're going to need as a first responder. All right, so a little bit about the standard competencies. We need to be able to use simple knowledge of the anatomy and function as first responders in order to understand how the body works so we can help people in the event of an emergency. It's in the lifespan development core related concepts. Introduction, you need to understand these basic structures and functions of the human body. This knowledge is going to help you to understand the specific locations and symptoms that the patient's experiencing and also be able to allow you to do an adequate patient exam. All right, so topographic anatomy, this is slide number 5 of 58 that shows you some different locations of the anatomy physiology. These anatomic terms are used to describe the location of injury or pain. All members of the EMS team must be able to speak the same language when treating patients. If you cannot remember the proper anatomic term for certain body locations, you can also use layman types of terms in the body positioning itself, left, right, front, back, those kind of things. All right, so the standard anatomic position is a person standing and facing you with arms to the sides and thumbs pointing outward. That is called the anatomic position of human anatomy. The anterior is the front surface of the body, the posterior is the back surface, and the midline refers to an imaginary vertical line drawn from the head to toe that separates the body from the left half and the right half. Standard anatomic positions: medial, lateral, proximal, distal, superior, and inferior. Medial is obviously closer to the midline of the body. Lateral is away from the midline. Proximal is close, and distal is distant, very easy to remember. Superior is closer to the head, and inferior is closer to the feet. Right, so body systems work together to perform common functions. The respiratory system, specifically, it consists of structures of the body that contribute to normal breathing. The respiratory system brings oxygen into the body and removes waste gases, such as carbon dioxide. All right, so here's a diagram of the respiratory system. It shows the upper airway and its contents, to also include the lower airway from the trachea to the bronchioles to the main bronchus and the lungs and the diaphragm. You'll see good representation of this in your book. All right, so those are the airway. It consists of the following: nose, mouth, throat, larynx, trachea, and passages to the lung. As you can see, here is another diagram. This is slide 11 of 58, showing the different structures of the airway anatomy. Oxygen and carbon dioxide. All right, so the airway extends into tiny air sacs called alveoli. Oxygen in inhaled air passes through the thin walls that separate the air sacs from the blood vessels and is absorbed by the blood. So we absorb the oxygen through a process called diffusion. Carbon dioxide passes from the blood across the same thin walls into the air sacs and is exhaled. The rate of breathing increases when the body needs more oxygen or when it generates additional carbon dioxide. This figure shows you the exchange of carbon dioxide, CO2, and the oxygen, or the O2 within the lungs. It shows the exchange, as you can see right here. Pretty interesting stuff how this works. And like I said earlier, it's all based on what we call diffusion. This area right here is the tiny little air sacs or the alveoli where the air exchange occurs, or the oxygen carbon dioxide exchange occurs. Carbon dioxide being the blue and the oxygen being the red. I'm sorry, that's just the opposite. Carbon dioxide being the red and the oxygen being the blue. All right, so the respiratory system. Air is inhaled when the diaphragm moves downward and the chest muscles contract to expand the size of the chest. Air is exhaled when the chest muscles relax and decreases the size of the chest. So this is just changing of pressures inside of the lung that form inspiration and expiration. Right, the circulatory system, it includes the heart, the blood, and the blood vessels. This figure shows you the different structures. It shows you the heart here, okay? It's in the center of the chest. It shows you the main artery, which is the aorta, and also how it's divided, the vena cava. That is this blue. This is where the unoxygenated blood flows. You have the inferior and superior vena cava that separates the inferior, obviously being below, okay, inferior or towards the feet. So here is the inferior vena cava, and then up here is the superior vena cava, here above the heart. All right, so the flow of blood. Blood picks up oxygen in the lungs and then goes to the heart. The heart pumps it out to the rest of the body. The cells, which are very, very important, our bodies are built up of billions of cells. They absorb the oxygen and the nutrients from the blood, and then they have to release waste products. It's at the end of metabolism, so they will release waste products to be distributed through the body and eventually eliminated. Blood carries the waste back to the lungs and to the kidneys. In the lungs, the blood exchanges the carbon dioxide for more oxygen. The heart consists of 4 chambers. Each chamber is called an atrium. That's the upper chambers. And then each lower chamber is called a ventricle. So you have 2 atriums and 2 ventricles. The chambers work together to pump blood through the lungs and the rest of the body. A one-way or one-wave check valves allow for the blood to flow in only one direction. So you have 2 atriums and 2 ventricles. They work independently from each other. There you go. There's a good diagram of the heart. The schematic represents the functions of the 4 chambers of the heart. It shows you how the blood comes in. Remember we talked about the inferior vena cava and the superior vena cava? All right, so this is where the unoxygenated blood flows into the heart. As you can see, it flows into the right atrium right here, okay, from both of those vessels. It is then pushed down into the right ventricle. The right ventricle then pushes it up into the pulmonary arteries, which takes the blood to the lungs, where the carbon dioxide is removed and oxygen is replenished. And then with replenished oxygenated blood comes back through the pulmonary veins, from the lungs, okay, and empty into the left atrium, okay. It is then pushed down to the left ventricle, which left ventricle then pushes it up through the aorta. So just kind of something to remember is everything comes through the atriums first, and the ventricles are the workhorses. The ventricles are the workhorses that move it around to where it needs to be, okay? So the unoxygenated blood comes into the right atrium, and the oxygenated blood that comes from the lungs goes into the left atrium, and then everything is pushed down into the ventricles to get it to where it needs to go. That's a good way to remember that. Major arteries carry away from the heart at high pressure and therefore have very thick walls. There are 3 major arteries. You have the neck artery, which is what we call the carotid. You have the groin artery, it's what we call the femoral artery, and then the wrist artery, which is what we call the radial artery. These are all very important arteries that we can feel pulses at when we're checking to see if somebody has a pulse or not. All right, so here's the locations of those arteries. Okay, it shows you the carotid artery here, the femoral arteries, both left and right, and the radial arteries. Okay. Capillaries are the smallest vessels. Veins are thin-walled vessels that carry blood back to the heart, and blood has several components. Plasma, which is the water part of blood, and that's the most highest concentration of components of blood is their plasma. Then you have red blood cells that carry the oxygen, white blood cells that generally are for fighting infections, and then platelets, which are generally used to form clots, along with other proteins that will form a clot and help stop you from bleeding. All right, skeletal system. The skeletal system consists of bones and connective tissue that protect and support the framework of the body. Without the bones, we'd just be a big old blob of goo, so we have to have bones to give us structure. It has three major functions. It's to support the body, protect internal vital structures, and also to manufacture red blood cells, because we got to replace those. From time to time, they get worn out and they have to be discarded. All right, so there's your skeletal system. Shows you the skull, shows you the shoulder girdle, the clavicle, the scapulas, the humerus. You need to be familiar with these terms, okay? Absolutely familiar with these, because it'll help you to identify when you're trying to tell somebody that's coming to take over your patient, because you were the first one that got there as a first responder. You'll be able to tell them what you found as far as where the patient is having pain or where you saw a deformity. So like if you said you had a deformity at the left femur, okay, that would be, instead of saying the left thigh, you could say left femur, because that is the bone that's in that area. All right, so the skull. The bones of the head include the skull and the lower jawbone. The skull consists of many bones fused together to form a hollow sphere that contains and protects the brain. The jawbone is a very movable bone that is attached to the skull, and it completes the structure of the head. The spine. The spine consists of 33 different vertebrae. The spine vertebrae are stacked one on top of the other, and they're held together by the muscles, the tendons, the disc, and the ligaments. The spinal cord passes through the center of the spinal vertebrae themselves. The spine has 5 sections. It has the cervical spine, okay? The cervical spine is the neck. It has the thoracic spine, which is your upper back, lumbar spine, which is your lower back, your sacrum, which is the base of the spine, and your coccyx, which is the tailbone. There you go. As you can see here, cervical vertebrae, there's 7 of them. Thoracic vertebrae, there's 12 of them. Lumbar vertebrae, there's 5 of them. And the sacral vertebrae, there's 5 of those too. And the coccyx, okay, which is here, has 4. This is the way I remember this, and it works for me. I don't know if it'll work for you or not, but at 7 a.m., I eat breakfast, okay? At 12 o'clock p.m., I eat lunch, okay? At 5 o'clock p.m., I eat my dinner meal, okay? And then at 5 o'clock in the morning, I get up, okay? I exercise. I go to the gym. You know, I do my chores and that kind of stuff. And then by 4 o'clock the next afternoon, I end the rest of my day, okay? So I always end my day at 4 o'clock, so I make sure that I have dinner at 5 o'clock. So you can kind of remember that. So 7 is breakfast, 12 is lunch, 5 o'clock is dinner, 5 a.m. is when I get up, and 4 o'clock in the afternoon is when I finish my day. Okay, so that's the way I remember it. Hopefully that'll be helpful. All right, so the shoulder girdles. Each shoulder girdle supports the arm and consists of 3 bones. The collarbone, which is the clavicle, the shoulder blade, which is the scapula, and the upper arm bone, which is the humerus. The upper extremity and the upper extremity itself consists of 3 very specific bones. Let's get rid of me real quick so you can see that. Okay, let's see here. All right, 3 major bones. There you go. The upper extremity consists of 3 major bones. Let's go over that. All right, so the upper extremity, the upper arm is called the humerus. That's the very upper portion of it where it connects into your shoulder. That is the humerus. The forearm has 2 bones called the ulna and the radius. And the way you remember that is that, look at my hand, okay? The radius bone is where the radial artery is. It is what allows you to turn. It's what's closest to the thumb. That is the radial bone. The ulna is on the other side. So radius is where the thumb is. It allows you to turn your hand, okay, to radiate, to turn your hand on a radial motion. The wrist and the hand also consist of several bones themselves. Then we have the rib cage. There are 12 sets of ribs to protect the heart, lungs, liver, and spleen. The rib cage, the sternum, is located on the front of the chest, as you can see here. You have the sternal notch, which is the very top. If you feel right here, it's where your clavicles come together. It's that little soft spot that you can feel there. Just below that is your manubrium. Then you have the body of the sternum and the xiphoid process. And as you can see here, there are the 12 sets of ribs. Okay. The pelvis, it serves as a link between the body and the lower extremities. Okay, it protects the reproductive organs and other organs located in the lower abdominal cavity. The lower extremities are both left and right. Each lower extremity consists of a thigh and a leg. The thigh bone is what we call the femur. Remember, we discussed that earlier. It is the longest and the strongest bone in the entire body. The leg has two bones called the tibia and the fibula. The kneecap or the patella is a small flat bone that protects the front of the knee joint. The ankle and the foot consist of a large number of smaller bones. Joints. This is where the two bones come in contact with each other. A joint that's where it's formed. It's held together by supporting tissue called tendons and ligaments, and it's lubricated by a thin fluid that's contained in a sac surrounding the joint. That's called synovial fluid. All right, so here's your joints. There's three types of very specific joints. You have fused joints, hinge joints, ball and socket joints. Okay, as you can see here, this representation is a ball and socket joint. Okay. Notice the ball and then the little socket, henceforth. And this is a hinge joint. Okay, this is where the bone comes into a hinge-like structure. So these are your two different types. Now, the other joints that you see here in this area, these are fused. Okay, those are fused joints. That's for your rib sections, where your ribs are connected in from your sternum, because most of this is just cartilage. Okay, so it is a joint, but it's fused. This ball and socket would be an example of just like what's in the humerus, where it comes into the socket of the sternoclavicular area in the shoulder girdle. All right, so skeletal muscles, they provide support and movement. They alternately contract and relax to make that happen. Smooth muscles carry out automatic functions. We also call these involuntary muscles. And then cardiac muscles are only found in the heart. All right, so the nervous system, it governs the body's function. It's what makes everything work. Okay, it consists of the brain, the spinal cord, and the individual nerves that extend throughout the body. All right, so here's a good representation. It talks about how the brain, the sensory and the motor areas of the brain, okay, they pick up information. This particular diagram shows that, I guess this is a ball that's being thrown. So we can see the ball coming. The sensory nerves in the endings of the extremity can feel that. Okay, so they suddenly flash up to the brain, and then the brain gives a signal right back down to the motor nerves that tells you to grasp that ball when it comes to you. So sensory and motor nerves are the big thing. That's what keeps things going. Another example that is when you're reaching out to grab something and you feel that it's hot, the sensory nerves send it to the brain, and then the brain sends down to the motor nerves. Oh, don't touch that. It's hot. So that's a good example as well. All right, so the brain is the body's central computer and controls the following functions: thinking, voluntary actions, and involuntary functions. The spinal cord is a long tube-like structure that extends from the base of the brain and runs down through the vertebrae of the body of the spinal cord itself. We talked about that. And then it branches off into all the different nerves that go to all the different structures of the body. And so the digestive system, it breaks down food into a form that can be carried by the circulatory system to the cells of the body. The cells have to have nutrients, and that's what the digestive system does for us. Food that is not used is eliminated as solid waste. Major organs of the digestive systems are located within the abdomen. The digestive tract begins at the mouth and continues through these structures: the throat, the esophagus, the stomach, the small intestine, the large intestine, the rectum, and then finally the anus. This is a good diagram of the digestive system. It also includes three other organs: the liver, the gallbladder, and the pancreas. Each one of them have a job to do. All right, so genitourinary system. This is responsible for the body's reproductive functions and also the removal of waste products. The major male reproductive organs are the testes to produce sperm and the penis that delivers the sperm. Major female reproductive organs are the ovaries, which produce the eggs. The uterus holds the fertilized egg during pregnancy. The egg is released by the ovaries and travels to the uterus through the fallopian tubes. The external opening of the female reproductive system is also called the birth canal, that is also known as the vagina. The removal of waste products begins in the kidneys, which filter from the blood to form urine. The urine flows down from the kidneys through the tubes and ureters into the bladder. The bladder collects and stores the urine before it passes out from the body through the urethra. Okay, let's talk about the skin. Skin covers all parts of the body. It has three major functions. It protects the body against harmful substances in the environment. It regulates body temperature and also transmits information from the outside environment to the brain. The dermis is a deeper or inner layer of the skin. The epidermis is the outer layer of skin, which is located upon the dermis. Here's a good illustration of the skin. It shows you the epidermis and the dermis. It also gives you some other structures in there. It shows you the pores of your skin, the hair follicle shafts, the nerves, those kind of structures that are involved more technically within the skin itself. All right, so the skin is an effective barrier to bacteria and viruses as long as it's not broken by injury. The skin can also perceive or sense of touch, pressure, pain, or degrees of hot and cold. All right, so the stages of growth and development are the stages of life. Throughout a person's life, the body changes constantly. In an infant, the airway is very small and it's easily obstructed by swelling or objects. Because toddlers have poor coordination and balance, they are at a high risk of falls. And then school-age children are physically active and prone to injuries from bicycle riding or other athletic types of mishaps. Adolescents, which is 13 to 18 years old, see themselves as invincible and do not fully understand the consequences of dangerous actions. So that inexperience and risk-taking leads to a higher incidence of vehicle crashes among young drivers. Early adulthood, which is between 20 and 40 years of age, is the period when most body systems are fully developed. Most people enjoy good health during this particular period. Then they move into middle adulthood, 41 to 60 years old, which is generally the time when the body systems start to decline. Vision and hearing becomes less acute. Cardiovascular and also respiratory status start to weaken. Women begin to experience menopause during their late 40s and early 50s, and weight control becomes more difficult for most people. Then during late adulthood, which is 61 years and older, the decline that started in the middle adulthood becomes more pronounced. People in this age group are more susceptible to fractures, burns, and also falls. The incidence of also mental decline and senility begins to increase. Vital signs. Vital signs most commonly measured. Normal physiological changes throughout a person's life do result in increases in occurrence of certain illnesses and the injuries and at certain stages of life. And those vital signs are most commonly affected by that. So with it, vital signs is measuring a patient's vital signs. It allows you to evaluate the variety of bodily functions. The most commonly measured vital signs are pulse, which is the heart rate, respiration rate, blood pressure. Normal vital signs change with age. Pulse rate decreases with age, respiratory rate decreases with age, and systolic blood pressure increases with age. All right, so this is our typical vital signs. Infants, children, adults. It gives you a good roundabout baseline for those kind of vital signs. Table 6-1, you'll find that in your book. All right, so variations in those normal vital sign values depend on these following three factors: the person's size, the person's degree of physical conditioning, and the medications that the person takes. This is also in your book, Table 6-2. All right, and so in summary, in this particular chapter, in this lecture, we've talked about the respiratory system and how it consists of lungs and the airway. We talked about the circulatory system, which consists of heart, which is the pump, the blood vessels, which is the pipes, and the blood, which is the fluid. We also discussed the skeletal system and how it consists of bones of the body. The muscular system consists of three kinds of muscles: voluntary, which are skeletal muscles, smooth or involuntary muscles, and then cardiac, which is your heart muscles. We also talked about the nervous system, how it consists of the brain, the spinal cord, and individual nerves. We also went over the digestive system, which consists of the mouth, the esophagus, the stomach, the intestines, the liver, the gallbladder, and pancreas. The system breaks down the usable food for use by the body and eliminates the solid waste. We also discussed the genitourinary system, which consists of the organs of reproduction, together with the organs involved with the production and excretion of urine. And then finally, the skin covers all parts of the body. It protects the body from the environment, regulates the internal temperatures of the body, and transmits sensation from the skin to the nervous system. It gives us a basic understanding overall, and we discussed it somewhat about the body systems and providing you with background that you need to treat the illnesses and injuries that you're going to encounter with patients as an emergency medical responder. We also gave you an understanding of some of the changes that occur with different stages within the life cycle that will help you understand and treat the wide variety of patients you will encounter. Also, vital signs, we went over how it changes at different points of life within those cycles. You need to understand these changes so that you will appreciate the differing values that you're going to encounter with patients of different ages. All right, so assessment time. Congratulations for completing your lecture. So what's next? Go back to your JBL Navigate dashboard, go to the assessment block, open up the chapter assessment for this lecture, complete the assessment and submit. You may take the assessment as many times as you like, and you must achieve 70% or higher in a cumulative score for each one of the chapters. Thank you for your participation in this program. If you have any questions for your instructor, please email them to student@emets.net. We'll see you next time.